Okay, Dr. Sean, lay it down. Tell us, as a neuroscientist, neuroradiologist, for over 32 years with your profession, why are you so excited about activated liquid collagen and NRF2? But now that we have this research here, how was that aha moment for you?
Well, I mean, I just, first of all, it just made sense that there would possibly be some synergy between the two products, because they're both operating and affecting areas that optimize cellular function, that reduction, that removal of that oxidative stress. And remember, the brain is, 70% fat, at least the solid portion of it. And so oxidative stress affects the brain. And then you have something that impacts the extracellular matrix, which is involved in signaling. And that's basically the brain's job, is to signal from one neuron to the other, and that cellular communication is impacted by, speaking of doctor in the house, the Dr. McKee's getting called, that cellular communication can be impacted both mechanically and biochemically, and that's what the collagen and SOD and the glycine in the collagen does. And the really exciting thing is what we're finding in the study, that it lowers that modulates that immune response, and the cytokine storm is extremely. We heard about that in times past with it was kind of one of those scientific words that came out into the news. And if you think of the brain, I wish my husband would close the door, but he didn't. But anyway, when you think of things, yeah, he did. Thank you, my husband. When a person has brain surgery, sometimes certain tumors are very sensitive to manipulation. And, in fact, my dog had one, not in his brain, but on his skin. And sometimes when you operate on a tumor, it creates such inflammation around it. The cytokine storm is something that happens. And in the brain, it's a closed space. You've got a hard cranium around the brain. And if I actually have a dear friend of mine who had a meningioma removed from her brain, and that got irritated, and the swelling, they had to keep a piece of her skull kind of in storage until the swelling came down. It's so profound. And the fact that this combination really lowers that effect of cellular stress so significantly. Not only that, it not only lowers the effect of it, but it lowers the processes, the very, interleukins that are involved in it, and interleukin 1, interleukin 6, those things are reduced, 88, 97%, which is just huge for creating a healthy, balanced immune response, a healthy, balanced inflammatory response. So important for the brain and every other. Yeah.
So is this a product, Dr. Sean, that you will be taking for the rest of your life?
Absolutely. And on days where I have exceptional stress or post-workout injury or anything like that, I'll take it twice, because, and I'll take it in combo for the second time. I in the past, before I had the results of the study, if I felt like I needed extra collagen, I would take a second collagen during the day. But now I do the duo together, because, why not? And what, I will tell another story. It's not a personal story to me, other than she's a friend of mine, and maybe somebody else was going to tell this story. But a friend of ours, who had been experiencing, kind of a circumstantial low mood, and just kind of not herself after starting. She'd already been on the NRF2. After starting the collagen, just kind of after about, I don't know, I think it was 6 to 8 weeks, just started becoming herself. And now we can understand why, because that inflammatory response, that hyper reactivity was just calmed down, and it allowed her to be able to almost return to normal in spite of very difficult situations. So I love that the science is demonstrable in terms of how people feel, both from their mind and their body, cell in the body.